If your big toe suddenly feels like it's on fire at night, that could be gout. Gout is not just a rich man's disease as it was described in the book. It's a real crystal arthritis that causes damage to joints and kidneys. Many people think gout is only about food, but the real story involves uric acid metabolism, kidneys, inflammation, and genetics. One of the most painful forms of arthritis can often be prevented if you catch it early. If you get sudden swelling in the toes, ankles, or knee, do not ignore it. It may be gout. It does not affect shoulder joints or hip joints. Hello, everyone. I'm Dr. PK. Today, we are talking about gout. I just had a patient of gout, so I thought I have not created such a common issue. So this is all about gout today. One of the most painful and misunderstood form of arthritis. Many people think gout is just from eating too much meat or drinking alcohol, and that's the only part of the story. In this video, I'll explain what gout really is, the pathophysiology in simple language, who gets it, and how to prevent gout attacks, and the best treatment option for both sudden flare ups and long term control. So stay till the end because I'll also explain why treating only pain is not enough. Gout is a type of inflammatory arthritis caused by uric acid crystal deposition in the joint. Normally, uric acid is a waste product formed when body breaks down purines. Purines comes from your own body's natural cell turnover and certain foods and drink. Usually, uric acid dissolves in the blood and passes through the kidney and leaves the body in urine. But when uric acid builds up too much in your blood, it can form a needle shaped monosodium urate crystals. And this crystal deposit in joints, soft tissues, sometimes kidney, and this is what causes gout. And the classic site for gout is the big toe. But gout can also affect your ankle, foot, knee, wrist, fingers, elbow. It doesn't affect shoulder joints or hip joints or spine. What is happening inside the body? That's pathophysiology. Let's make this very simple. Uric acid level goes up. Gout usually starts when the blood uric acid level, urate level becomes high enough that crystal can form. Crystals tend to form once urate exceeds the saturation threshold, roughly around 6.8 milligram per deciliter, which is why treatment aims to keep levels below that range. And the NICE recommends aiming for serum urate crystal below 6. And that's my goal always. And some patient with a history of other complication and recurrent flare-ups or tophi, which is a deposit of urate crystal in a soft tissue, we tend to keep it below 5. Crystal deposit in the joint. This crystal sits silently in the joint for a while. A person may not even know they are there. Then number 3 is immune system attack. Then suddenly the immune system recognizes this crystal as a danger signal. White blood cells rush in and release inflammatory chemicals. And this is why gout attacks become sudden, red, hot, swollen, and intensely painful. Recurrent inflammation causes damage. If gout keeps happening, is not treated properly, crystal continue to build up over time. This can lead to repeated painful flare-ups, chronic joint inflammation, joint damage. Tophi, which are visible urate deposits under the skin and creates a bumpy skin. I have one patient who has so much tophi, I've never seen that in my life. And he's in his 60s. And I asked him how long he had this. He said, for 30 years. Like, why didn't you get the treatment somewhere with, proper doctor? He said, It was not about getting the treatment. He was very non-compliant because he likes to eat red meat and he likes his beer, and he would not change for anything. Anyway, sorry about digression. So remember, gout is not just pain, it's a chronic crystal deposition disease. Why does gout happen? Risk factors. Gout can happen because the body either makes too much uric acid or commonly does not remove enough through the kidney. Common factors: genetics, family history, obesity, chronic kidney disease, dehydration, high alcohol intake, especially beer and spirits, diets high in organ meats, red meat, some seafood, sugary drinks, especially those with fructose, diuretics like hydrochlorothiazide or furosemide, Lasix, high blood pressure, metabolic syndrome, diabetes, sleep apnea. Certain medication can also worsen gout, especially some water pills. This is why gout is often connected to overall metabolic health. What does a gout attack feel like? Typical gout symptoms are sudden severe joint pain, often at night, redness, swelling, warmth, tenderness, so severe even a bed sheet can hurt, difficulty walking if the foot is involved. Some attacks last for a few days, others last longer if untreated. The diagnosed by history and examination, uric acid blood test, joint fluid analysis to look for urate crystal. Important point: a normal uric acid during an acute flare does not fully rule out gout. The most definitive test is finding monosodium urate crystal in joint fluid. And gout can mimic pseudogout or infection. What is the treatment? For acute gout, the goal is to reduce inflammation and pain quickly. So common treatment includes ibuprofen, naproxen, indomethacin, colchicine, corticosteroid tablet, or sometimes joint injection. And the right treatment depends upon kidney function, any stomach ulcer history, blood thinner use, diabetes, and other medical issues. During the flare-up, rest the joint, use ice, drink enough water, avoid alcohol, binges. Very important. Pain treatment helps the flare, but it does not remove the crystal burden. Long-term treatment, how to actually prevent gout. And if you have recurrent gout attacks or tophi, which is a deposit under the skin, a chronic gouty arthritis, kidney stone, ongoing urate burdens, you may need urate lowering therapy and long-term treatment, allopurinol and febuxostat, sometimes uricosuric drugs in certain cases. Aim is to lower serum urate level below 6, sometimes below 5. And usually start with a low dose and adjust gradually. What you can do to prevent it: lifestyle changes that help reduce gout, healthy weight, avoid crash dieting, stay hydrated, reduce alcohol, especially beer, limit high purine food like organ meat and some seafood, reduce sugary beverages and high fructose drinks, manage blood pressure, diabetes, and kidney disease, review medication with your doctors. Food that will help you is low-fat dairy product, vegetables, balanced protein intake, and overall heart-healthy eating pattern. Diets help quite a bit. Gout is not a moral failure, it's a medical condition. You should seek urgent care if you have fever with hot swollen joint, the pain is severe and diagnosis uncertain, you cannot bear weight, and there's a concern of infection. Gout is a crystal arthritis caused by uric acid buildup. Inflammation is intense, it's treatable, often preventable. So I'm Dr. PK from Dr. PK Life, and giving you practical information, and my goal is to make you smarter. And thank you for watching, and thank you for asking all very interesting questions. Have a nice Monday evening.